Hello guys, welcome to yet another video in the Two Doctors Travels Healthy Heart series. In this video, I Dr. Hashmi will be discussing briefly about what diabetes is, what are the types of diabetes and what is the best diet a diabetic can have to prevent short-term and long-term complications. Let me start off by telling what diabetes is. So when you consume any kind of food, the glucose in that food enters your bloodstream, and in order for this glucose to be absorbed by your muscles or any cells in your body to drive energy, you need something called as insulin. The insulin in your body is secreted by an organ called as the pancreas. The insulin secreted goes to your muscles, act on receptors called as insulin receptors and help the glucose enter. So when the pancreas don't secrete insulin, this leads to something called as type 1 diabetes. On the other hand, there is type 2 diabetes where the insulin secretion is normal but this insulin fails to act on the receptors. This is called as type 2 diabetes. Now, to label a person a diabetic, you need to perform certain tests called as a fasting blood glucose level, wherein you ask your patient to fast for 8 hours and then measure his blood glucose level, followed by postprandial blood glucose level, where typically the glucose values are taken 2 hours after he consumes any kind of food. Lastly, we also measure the HbA1c, which gives you an idea of the glucose maintenance value over 120 days, that is the lifespan of the RBC. So I would compare the normal values of these three tests with a person who has diabetes. So a fasting blood glucose level for a normal person is less than 100. For a diabetic it is greater than 126 milligram per deciliter. Now the question comes, if a person's value of fasting blood glucose level is between 100 to 125, this range would put a person into what is something called as pre-diabetic category. What is pre-diabetes? Pre-diabetes is a metabolic disorder which occurs just before diabetes, and the good thing about it is you can take health changes that like eating properly and exercising so that you can reverse and go back to normal instead of becoming a diabetic. Let us come to the postprandial value. The postprandial value for a normal person is typically less than 140. For a pre-diabetic it is between 140 and 199, and for a person who has diabetes the postprandial value is about 200. The HbA1c value for a person who is normal, the HbA1c is less than 5.7. For a pre-diabetic, the values are between 5.7 to 6.4, and for a person who has diabetes, the HbA1c value is above 6.5. Now let me move on to types of diabetes. Typically there are two types of diabetes, type 1 and type 2. Now there is also a type of diabetes called as type 1.5, which is a form of type 1 diabetes. So I would compare these three diabetes keeping few parameters in mind. Number one is age. Type 1 diabetes, the manifestation is typically early, that is the patient is less than 30 years of age. For type 2 for type 2 diabetes, the age of onset is high, that is above 30 years. And for a person with type 1.5 diabetes, the type 1.5 is same as type 1, but it has minor changes. One of the thing that demarcates it from type 1 is the age of onset. It has an age of onset about 30 years. Now coming to C-peptide values. What is C-peptide? C-peptide is something that is secreted along with your insulin. So if you want to measure the insulin value, you can use the C-peptide. Now why to use the C-peptide? C-peptide is used because the values are more stable than insulin, and it has got a longer half-life time than insulin. The C-peptide level for type 1, as there is decreased insulin secretion, is typically low, and it falls between 0.8 to 1. Even in type 1.5, as it is same as type 1 with few changes, it is low, but when compared to type 1 it is a bit higher, so it falls between 1 to 1.2. For type 2 it is high, as the insulin secretion is in fact more than normal. The problem lies with the receptors. Now coming to antibodies. As type 2 is not an autoimmune disorder where there is destruction of pancreas, and it has got nothing to do with autoantibodies, I put a cross here. But when I compare type 1 and 1.5, in type 1 there are two types of antibodies that destroy the pancreas. When compared to type 1.5, it has got only one type of autoantibodies, and obviously there is slower rate of destruction of the pancreas when compared to type 1. So when I compare the speed of destruction of pancreas and onset, when I compare 1 and 1.5, the speed is high here and it is low here. And obviously for type 2 it takes years to develop type 2 diabetes, so the speed is very low. Now let me move on to low carb diets and what they do. Most of the patients initially are put on low carb diets, and most of us know that it is beneficial, but I would counter that thing, as there are a lot of drawbacks on long term basis if you consume low carb diets, especially for diabetics, both type 1 and type 2. So let me discuss the pros and the cons. The pros are that on a low carb diet your blood glucose level comes down instantaneously. As there is decreased blood glucose level, your insulin requirement comes down, and also there is weight reduction. The weight loss leads to decrease in your lipids, and obviously as the blood glucose levels are low, the HbA1c value also decreases. What are the cons? The cons of low carb diet on long term basis, I would present it as LT, is there is development of insulin resistance. Now you might ask me, why is there insulin resistance developing in low carb diet? I would discuss this in the next two slides. But what happens with insulin resistance? Insulin resistance causes a lot of issues. It causes atherosclerosis that leads to occlusion of arteries and leads to heart problems, CADs. It leads to chronic kidney disease, peripheral neuropathy. It leads to a lot of problems, and it also increases your all-cause mortality, that is chances of death due to any ailment. Now I would tell you how low carb diets on long term basis develop insulin resistance and cause problems in type 1 diabetics. Now let us assume this is the liver, this is the blood vessel, this is the pancreas that secrete insulin, this is the muscle. Now for a person who is not consuming carbohydrates, is consuming low carb diet and is depending solely on proteins and fat for energy, he has got a lot of fatty acids in his blood vessels, and these fatty acids are absorbed by the liver and muscle to gain energy. And as they get used to high levels of fatty acids, they upgrade their beta oxidation enzymes, and over time they decrease the habit, or they lose the habit of using insulin and glucose. Over time there is deposition of fat in all the organs due to the high levels of fatty acids. And suppose a person in such a situation consumes something that has got a bit high amount of glucose. Suppose he has 3 to 4 bananas, and this glucose enters the bloodstream. And in type 1 diabetes, there is no secretion of insulin. So a person solely depends on insulin injections or exogenous insulin. And now he is accustomed to having low amounts of exogenous insulins, and this insulin tries to get the glucose that he has got in his bloodstreams due to the bananas that he consumed. But now the organs have lost the habit of allowing glucose in with the help of insulin. They have downgraded their insulin receptors due to disuse of the carbohydrate metabolism. This leads to a surge in the glucose level, and this is called as insulin resistance. So, why is it called as resistance? They are not able to take in glucose at the same level of insulin that he previously used to consume. Now he has got to have more amount of insulin to let the glucose inside. This causes insulin resistance, which obviously leads to the complications that I discussed in the previous slide. Now let us move on to type 2 diabetes. I will quickly draw the liver, the blood vessel, the pancreas, and the muscle tissue. Obviously, a person who is on low carb diet, as I discussed previously, has got a lot of fatty acids here, and when he consumes something that has got a lot of glucose in it, the glucose enters the bloodstream. And the good thing about type 2 diabetes is the pancreas still secrete insulin, so there is endogenous insulin that wants to get the glucose that has entered into the muscle stream. The same issue occurs, that is, the muscles have lost the habit of taking and using the insulin gates, and they have started to use fatty acids as their sole energy units, and have upgraded their beta oxidation pathways, and this leads to greater level of insulin to be secreted by the pancreas, which they can't, and which eventually leads to glucose piling up in the blood vessels, and this also leads to insulin resistance, which will lead to all the problems of chronic kidney disease, atherosclerosis, hypertension that I discussed in the previous slides. Now moving on to what diet is recommended for diabetics, both type 1 and type 2. The diet that is recommended is low fat, plant based whole foods. So what are low fat, plant based whole foods? I have discussed this in the types of diets and the diet that is best for CAD in my previous videos. I would urge you to see that video and come back here. So they include basically fruits, vegetables, legumes, and whole foods. You should recommend a diabetic to have it, and you should ask him to divide the food into 3 categories. That is the green category, the yellow category, and lastly the red category. So green category is something that you should have, yellow is you should have it with caution, and red is you should avoid the foods, just like the traffic lights. Now, the green, yellow, and red. Red is dangerous, yellow is cautious, green is what you should have. So the green category includes all the green foods, that is fruits, vegetables, legumes, and whole grains. The yellow category has foods that are beneficial, like nuts, seeds, olive oils, and avocados. The only problem with the yellow category is they are a bit high on lipids and fats, so you can't consume a lot of them. You should have them with the caution. You can't have large amounts of nuts, seeds, olive, and avocados. Now the red. The red category of foods include sodas, processed and refined carbohydrates. So what are processed and refined carbohydrates? These are the donuts that you have, the sweets. They also include all the items that are animal derived, that is oils, eggs, meat, fish. So what a person should do and what a diabetic should do is transition your path from red foods to having green foods this way. The more you shift from red to green, the more benefits you will have in terms of uh, decreasing the insulin resistance and, in fact, increasing the insulin sensitivity. And this will lead to all the benefits and decrease the all cause mortality. So, this is the main aim that a diet should have. It should cause increased insulin sensitivity and decrease the all cause mortality. So, hope you enjoyed the video and found it informative. I would urge you to share it with any diabetics that you know, or in general, to decrease your insulin resistance. Thank you. See you in the next video. Please subscribe to my channel, Two Doctors Travel. Bye bye.